Hello, everyone. My name is Elizabeth Manns, and I'd like to welcome you to the April 4th Coalition Show. This is the July 24th, 2023 edition of the show. It is the 463rd show that we have done since the closing of the North Adams Regional Hospital, and the third show since the announcement of the possibility of the hospital reopening with a critical care access designation. The April 4th Coalition's mission statement is: we are for workers' rights and collective bargaining rights and are against tax breaks for the rich and corporations who ship our jobs overseas. We support all the articles of the Universal Declaration of Human Rights, but as is our custom, we put the emphasis on Article 23, and 3 out of 4 on the panel are going to say something.
All right.
Read one.
Number 1, everyone has the right to work, to free choice of employment, to just and favorable conditions of work, and protection against unemployment.
Number 2, everyone, without any discrimination, has the right to equal pay for equal work.
Number 3, everyone who works has the right to just and favorable remuneration, ensuring for herself or himself and his or her family an existence worthy of human dignity, and supplemented, if necessary, by other means of social protection. Number 4, everyone has the right to form and join trade unions for the protection of his or her interests.
Thank you, Rachel, for doing two
Thank
of
you,
those.
Rachel.
And as the audience can see, we have a panel of 4, and we want to thank Susan Rose for coming on again. And on the realm of thank yous, we thank Michael Putnam for airing the audio portion of this show on WMNB LP 107.1 on Fridays at 6 p.m. and possibly at other times. And of course, the wonderful staff here at NBCTC, being Joanne, David, and Nicole, for helping us produce the show. And I believe we are continuing to keep the focus on the possible opening of the hospital, and you had set up a trip down memory lane.
Yes.
In regards to its history and
Yes.
closing.
You know, we have 3 videos, one on the announcement of the closing, then the announcement of the closing of the emergency room, and then how the legislature is still working to try to keep it open. This all took place in 2014, but then we have an announcement that happened just a month ago that we want to play, saying that, you know, they are indeed trying to open up again. So why don't we watch the first 2 at least, and have some comment after that.
And questions that many people in Berkshire County are asking today include: how did the hospital get into this financial crisis, and can anything be done to get out of it? 22 News reporter Matt Karen is live for us outside North Adams Regional Hospital with some possible answers.
North Adams Regional Hospital filed for bankruptcy in 2011, and their finances were audited by the state attorney general's office. But the state may have actually contributed to the root of their financial issues. SEUI spokesperson Jeff Hall told 22 News that 64% of the hospital's patients were on Medicare, and that the state only reimburses the hospital about 66 cents for every dollar of care provided, leaving the hospital with a gap that can only be filled through donations.
That makes North Adams very dependent on Medicaid funding from the state. Because the state is underpaid on those Medicaid rates for a long time, that's a key part in what precipitated the current crisis.
Hall said that the Medicare gap could be filled if the hospital was designated as a critical care facility, but that would require changing a state rule. Any hospital with that designation is required to be at least 25 miles from the next nearest acute care facility. North Adams Regional Hospital is 23 miles away. Reporting live just outside of North Adams Regional Hospital, Matt Karen, 22 News.
Yeah, we all remember that one. And
Yes.
and thinking, for the lack of 2 miles, we couldn't get the critical. Well, also back then, they didn't want it.
Right. Well, the other part is, I think they did want it at that time, but they just couldn't get it. They only got reimbursed 66 cents on the dollar. The state wouldn't come forward with the financing necessary. to keep the hospital open. So there wasn't a lack of need of a hospital. It was just a lack of funding for the people that needed the hospital. The reimbursement rates weren't high enough.
for them, and so that contributed to it, along with possibly another financial matter.
Well, they had debt on
If I
other
remember
real
right,
estate
the real
investments.
estate deal.
Yeah.
Right.
Did you
And
have?
of course,
Go ahead,
and
Rich,
of
you
course-
got that smile.
And of course, Rich and I and Liz, we kind of play devil's advocate, and of course, the reasons for the low reimbursement rate go state and federal, all the way to lack of caring, concern, and legislative intent and creation of a structural systemic change that corrected that lack of Medicare, Medicaid reimbursement, which is part of the problem at the hospital. So it's multifaceted what happened to this hospital.
And I'm sorry, Sue, am I cutting you off?
No, that's all right. I was going to say something about people in the community. Most of the people in the community have Medicare and Medicaid, and I think that's possibly part of the problem. They don't. As a matter of fact, I heard someone say the other day that some of the doctors don't want to take people that have Mass Health, and I thought that was kind of whether that's true or not.
It is true.
You know, but I mean, that's the.
It is. It is because.
I mean, that's terrible.
And the biggest problem with Mass Health is and Medicare is they
And
both
Medicare.
take forever to come through with the reimbursements. If you think about it, a person could die and you will still be getting. The Medicare will still be paying bills after they've died for 8-9 months, if not a year. So you add in that lag.
The
But there's also a significant number of doctors and hospitals that have taken money out of the Medicare and Medicare system by fraud. That is also an issue too.
Well, I won't mention names, but I had one doctor do a endoscopy on me and said that my throat was fine as far as my age, and then scheduled another one 2 months later and a visual one at BMC. And I went in and I told the nurse, this is not necessary.
Yeah.
He's billing me for something that isn't necessary. I said, and also the other test at BMC, the doctor came in and said, you know, we really don't need that test. And I said, yes. He said, and as far as the one at BMC, the visual one, we don't need that either. So I said to him, would you please check my ears for if I have wax in them, which he didn't even ask. And so what I'm saying is there's fraud in the community as far as even doctors, because guess what? I'm on Medicare. So the more I come, the more he gets. I don't know, if there's kind of.
Well, that's generally true even if you're on a private,
I don't
different
know,
system.
because-
I think your audience would be surprised to know that I am on Mass Health and Medicare, and I don't have a supplemental policy because I can't afford one in the medical care, chiropractic, acupuncture, and now chiropractic is covered, and therapy, massage, and because of the injuries when I was hit in a car accident. And it took me, the paperwork for people who are struggling, are poverty-stricken, is enormous. And it takes a long time to get it. I actually did have a BMC hospital cardiologist who did a consult without the report and filed a claim with Medicare, which I reported as fraud, and nothing happened. He never had the report.
Yeah.
So there's so many parts to this. But yes, and I personally know of doctors and places that refuse Mass Health. And
What-
they have no obligation, I think, to have to take it.
Okay, we have another video I
Yep.
want to show, and this was after they closed the doors of the hospital. The emergency room was still open for, I think, 24 hours, but then they made the decision to close that too. So let's hear the video on that.
North Adams Regional Hospital today closed the doors to its emergency room. 22 News reporter Juliana Mazza was in North Adams where concerned residents made their feelings known.
The emergency room at North Adams Regional Hospital is no longer open.
Although North Adams Regional Hospital closed its doors Friday, Saturday was the first day the emergency room shut down. Residents who protested the closing say it took them by surprise.
I thought yesterday we had an agreement where the emergency room was going to be kept open. And then at the end, after people left, we found out now they turned around and said it's going to be closed.
Union spokesman Jeff Hall told 22 News the hospital administration claimed they didn't have enough staff or equipment to keep the ER open. North Adams residents say they're not buying it.
Why would they lie and take people's lives in danger? They know they have all the equipment they need.
22 News is working for you to learn how the sudden emergency room closure would impact residents.
It feels like a bad dream. You know, you don't really think something like this, of this magnitude, could happen. The turnaround times will be longer, meaning we need to put more ambulances on the road, and that's what we've done.
North Adams Ambulance Service says before the hospital closed, it could take just minutes to transport a person to the hospital. But now, transporting patients here to Berkshire Medical Center in Pittsfield, they told 22 News in some cases that could take well over an hour.
Major emergency comes up. Unfortunately, the person might not make it.
And hundreds of former employees are now in the unemployment line.
When I found out about this, I cried because I've got friends that work up there. I've got a relative that worked up there. And I mean, some of those nurses have been up there, what, 30, 40 years? And it's a tragedy.
About 550 employees worked at the hospital. Staff and patients were only given 3 days' notice to the closing. Reporting in North Adams, Juliana Mazza, 22 News.
Yeah. I remember that day, I think, and being up there, and it was just like, you couldn't believe you had to be standing there saying, don't close a hospital.
I couldn't believe my ears, to tell you the truth, that we would be without an emergency room. It was like unheard of.
As I said at the time, this is a travesty. And it's, North Adams is a picture of what is happening across the country. So we are now demeaning and destroying and
That's what we are.
hitting people who are poverty stricken because they are poverty stricken. And that is not what the United States is supposed to be about.
No.
And you and I, all of us, have talked about universal health care. We need universal health care. And there's no reason anybody in this country should not have health care accessible.
And I heard there was a
Well, I
satellite.
always sit there
I'm
and
sorry.
whenever I watch these things, sorry, Susan,
No.
I always wonder why when the federal government set up that Medicare would only cover X amount, why didn't they set it up?
80%, yeah.
80%. Why didn't they set it up to cover all of it?
Yeah.
So that you wouldn't have this patchwork nonsense. I do realize the insurance industry at the time probably had a lot to do with it.
Oh, sure.
But the theory is if you were really planning to cover everybody, you should cover them 100%. There should have been no exceptions for dental, for hearing aids, for drugs, you know, and
those elected officials who say we're going to run out of Social Security and Medicare, the fear tactics are just not acceptable.
Yeah. They just have to let more people in the country because we're running out of young people. We just have to have more young people.
But look what the people who are trying to flee violence are horrible situations are
Right.
facing
But-
trying to come into this country.
Right. It's just opposed to what we need. We just need to have more younger people paying into the system. And there are people outside of our country that would like to come in and work, fill the jobs, and pay into Social Security and Medicare, and that would work. But before we go, we're talking about legislature.
I got one thing I have to say
Yeah.
before. I want to one-up you on that, Rich. I want to just say that could come right out of we have plenty of money for bombs and war. That money can be pulled right out of the Pentagon budget. And
No, the
corporate.
legislature could easily fund it if they
Just like
wanted
that.
to.
Right.
Even if all they did was raise, even
it's
if they
commitment.
just raised the percentage of the amount
What's
that's
the
being
next
paid
video?
in, they could do it.
Yeah.
It's not that hard. They just don't
Not
want to.
We're talking
They're
about the will.
The will. They're creating a crisis again.
Let's watch the
do
next
something
video,
else.
which talks about what the legislature was doing after the closing, but still in 2014.
Good evening and welcome to 22 News at 5:30. I'm Barry Krieger. North Adams Regional Hospital closed its doors late last month and filed for bankruptcy last week. But state lawmakers aren't giving up on the Berkshire County Hospital just yet. 22 News State House reporter Tiffany Chan discovered what's being done to reopen the hospital doors.
North Adams Regional Hospital filed for bankruptcy last week, but leaders on Beacon Hill are still working closely with Berkshire Health Systems to reopen the facility. There has been a series of meetings following North Adams Regional Hospital's decision to file for Chapter 7 bankruptcy last week. The Attorney General and the Department of Health and Human Services are still working closely with Berkshire Medical Center to reopen the facility despite dire financial issues.
We believe that the bankruptcy filing should not negatively impact what we are trying to do. The Attorney General is looking at what her options are in terms of continuing the temporary restraining order or not.
Secretary Polanowicz also told 22 News that Berkshire Medical Center has requested emergency services and outpatient diagnostic imaging services to be restored to the facility. He says these two elements are crucial to the people of northern Berkshire County. Bankruptcy trustees for North Adams Regional Hospital were in meetings today. Polanowicz said that he will be speaking with them, the Attorney General, and Berkshire Medical Center tonight on updates on whether the hospital will be reopened. At the State House, Tiffany Chan, 22 News.
Well, what's that say is, it says that the legislature was working on things. Notice they never mentioned the governor's name in that whole report. They talked about the Attorney General, but right then Governor Deval Patrick was in charge of the Massachusetts government.
And Maura Healey was the Attorney General.
No, I think it was Martha Coakley at the time.
Oh, in 2014?
I think it's pre the election, before Maura Healey came in.
Oh, yes,
but I want
excuse me.
We're pre the election.
The reason why we're touching on this is a reporter called me and asked me my reaction to Paul Mark's bill, which is in the Senate, which is calling for setting up a law that would not allow hospitals to close, putting them in receivership, where the state would take them over until they could find new management to run it. And that would have directly helped our situation. And I told the reporter that I thought it was great because sometimes a governor has a conflict of interest or just doesn't care. And we have proof of that. I know we had politicians say, gee, we didn't know what to do. It never happened before. But, we were trying to have this as a graphic, but I'm gonna have to read it to you. There was on Wednesday the 26th, that was the day after the announcement was made that the hospital was going to close in 3 days. Governor Patrick should declare a public health emergency to prevent North Adams Regional Hospital from closing. It was a letter written by Alan Sager, PhD, and Deborah Scholar, MPH. They wrote, Alan Sager and Deborah Soar, who have documented trends in the dangers of hospital closings in Massachusetts and nationally, call upon Governor Deval Patrick to declare a public health emergency to protect North Adams Regional Hospital. These are some of the reasons. Number one, declaring the emergency is justified. Former State Public Health Commissioner Howard Cole, now U.S. Assistant Secretary for Health, recognized over a decade ago that in Massachusetts, quote, we cannot afford to lose another hospital, unquote. One high state official said that as far back as 2001, that lives are really at risk, unquote, if another emergency room closes. Declaring a public health emergency would authorize the state government to control the North Adams Hospital. The action would cut through the assertion that the state lacks the ability to act. There is precedent for this form of state action to protect health. In 1976, Governor Dukakis declared a public health emergency to protect residents of a Merrimack Valley nursing home. Declaring a public health emergency will allow the Commissioner of Public Health to appoint a skilled hospital turnaround expert to manage the North Adams Hospital. That person will take the steps to raise patient volume and revenue and to cut costs. If the hospital closes, people in North Adams and North Berkshire would be endangered by the long distance and travel times required to reach other hospitals. For example, from the town of Florida, it would require 23-minute driving, at least 37 minutes if you're not rushing through traffic to the nearest hospital, which is Bennington. It would also be 25 miles at least, and 45 to 50 minutes from Florida to Pittsfield. Where Berkshire Medical Center is located. It would be 31 miles and at least 42 minutes to the Greenfield or Bay State. And he goes on to say that in the short run, North Adams Hospital should be given immediate claim on a financial aid from the state's Distress Hospital Trust Fund established in 2012, which is now at about $128 million.
Back then it was
Back
$128
then,
million.
$128 million were available to the governor to save this hospital, but he refused to act.
I didn't know that.
Yeah.
Oh, yeah.
In addition, funds can be gathered by reducing the state's increase in across the board to all hospitals and instead channel more of that money to the hospitals that are needed and in danger of closing. So there was a plan. I mean, there was a method. There was 3 pages. I've only read sections of it. But this was one day after the announcement. This professor at Northeastern University publicly sent a letter to Deval Patrick saying, this is what you can do to save that hospital. We have to save that hospital. It's necessary. And the governor just didn't have the will to do it. And our elected officials locally didn't have the will to push the governor to do it. It was, to me, it was I don't know, there were a lot of things in the back room going on, but if people were just interested in the health and safety of the people of North Berkshire, that hospital never would have closed. Never, never. And this legislation that Paul Mark has got in the Senate right now, has sponsored this bill, would be attached to another bill and would stop any hospital from closing in Massachusetts, would put it in receivership. So I encourage everyone to call Paul Mark, thank him, find more out about this bill. Let me see if I can get the name of the bill for you. Let's see. It's
Even if you can't find it, you just go.
Senate Bill 1406.
Okay.
And it's by Paul Mark, a petition. It's
you can call the office and support.
Right.
You can email and support.
You can.
It says the department, in conjunction with other state departments and agencies, shall promulgate regulations creating a process of state receivership for any hospital or freestanding clinic that provides essential health services. A, closes without providing the required 90-day notice. B, closes a hospital or freestanding clinic following a determination by the department that closure would constitute a discontinuation of services necessary for preserving access and health status in a hospital or freestanding clinic service area. These regulations shall include a mechanism and source for funding and receivership. That, we didn't get 90 days notice. We didn't get a public hearing. We didn't even get time to get our representatives to listen to the experts who said we could keep the hospital open.
And put political pressure to stop what happened.
To stop it from happening. And that's probably ultimately what killed it, was that not having the time frame. And that's the only thing that was unprecedented about the closing of the hospital in Massachusetts, because obviously they wouldn't have that fund if it hadn't happened before.
Well, I think that's
so. Therefore, the only thing unprecedented was the short 3-day notice that it was closing.
I think another mechanism you need is to find out where funds from any hospital that are going outside of that hospital, where they are going, and how they were allowed to go there. That is a major reason we lost our hospital.
Right. Failure to
One thing
oversight
that
on
I'd like to
spending.
say is that I was so happy to hear about the satellite emergency room, even though it was the satellite, because I probably wouldn't have survived if there was no emergency room.
Right.
Because
Well,
I
it's
have-
not really
you
an
know,
emergency room.
I know
It's
it's
yeah.
not, it's a satellite.
But hopefully when
But
we get this.
even with one, I'm just saying, years ago, I'm talking about, it was at least something that, but it wasn't enough.
No.
It's the point.
Yeah.
That I was trying to make, is that it wasn't enough.
Right, because if it had been enough, the travel time for people who are in distress
Exactly.
would have been a few minutes rather than, even if it was only, if it had enough to stabilize people so that they could be transported, but at the initial point it never did, and
Right.
it still doesn't have enough to stay. If you're in a major issue, they have to send you to BMC to get, because they don't have what they need to keep you alive.
I'm really glad it worked for you,
Obviously.
but obviously it did not work for
Yeah.
a lot of
I
people who
know.
went through horror shows.
Let's try to leave on a high note. Let's listen to
Okay.
the announcement of them opening up. It'll be the last video announcing that they're going to open the hospital.
Berkshire Health Systems has announced plans to reopen North Adams Regional Hospital. The hospital closed back in 2014, citing major financial trouble. Berkshire Health said they plan to seek federal and state approval to reopen up to 25 inpatient beds at its North Adams campus. They also want to be designated as a critical access hospital. The designation would allow the hospital to operate under its own license to offer inpatient medical surgical services, in addition to the emergency and outpatient services it currently provides. Pending approvals, Berkshire Health hopes to begin providing services again this winter.
Well, that's great. You know, so let's.
I have many reservations, so
Right.
I'm glad you're
I'm in the
optimistic.
cautiously optimistic
But
mode.
and the other part
But on the
too.
other hand, I don't think they'd make it if they didn't think they had a reasonable chance.
Yeah.
But what might bolster this? There's in the House of Representatives and in the Senate there is a bill in state of Massachusetts to establish a single payer Medicare for all here in Massachusetts. So if we can get that, if everyone has the equal coverage, everybody in, nobody out, and everyone's reimbursement rate is the same, that will strengthen North Adams Regional Hospital because it will be able to get the reimbursement rates that's needed. And it will get the same rates that the richer hospitals will get. And so it'll bolster the viability of the hospital. So,
It'll bolster the viability of any hospital.
and everybody, and there's 272 Massachusetts residents that lack health insurance in 2012, 4.1% of the population. So we need to get everybody in. So contact, our Representative John Barrett is a co-sponsor of the bill. Everyone all the representatives in Berkshire County, Paul Mark in the Senate, are all behind this bill. We just have to keep pushing it to get it through the state Senate. and
That's
the
a good
state
high
House
note to
Representatives.
leave on.
That is a good high note.
Healthcare
Yes.
for all.
Yes.
Healthcare,
Definitely.
not insurance. Healthcare.
Healthcare.
Healthcare for all.
Power to the people and health care for all the people.
Yes.
And the discussion will undoubtedly be continued on the next
Yes.
show, so we'll see you next week.
Okay.
There's power in the factory, power in the land, power in the hand of the worker. But it all amounts to nothing if together we don't stand. There is power in our union. Now the lessons of the past were all learned with workers' blood. Mistakes of the bosses we must pay for. From the cities and the farmlands to trenches full of mud, war's always been the bosses.